to the side above their head. Good, back down, come forward and above your head, and I'm looking to see if one is less than the other. Next thing I do is usually palpation, because the external rotation, internal rotation I'll do later on. So I'll come from the front so you can see. Again, we'll find that clavicle, say you found on yourselves, come across. You can see her AC, this is the prominence of that tip of the clavicle, so her AC joint is right here. Okay? So I'm going to push here, tenderness for the AC joint. This is the acromion right there, so that's the bony ridge right there. Next to it is a soft spot, that's where that bursa would be. So that's where I'm going to push. Again, I'm going to go back to her AC joint. I'm going to come down 2 or 3 finger breaths. I'm going to feel that bony prominence, and hopefully you guys felt it on yourself. That's the coracoid process. Just below that, I'm going to push in, and I'm going to feel the band across there. Okay? That's the short head of the bicep. I'll come a couple fingers lateral to that, still underneath the acromion, so right here, and across there, I'll feel a band again, and that's the long head of the bicep. Okay? I'm done with palpation then, for the most part. I can do the crossover test, so bring your arm across your body, and then I can load it and push a little bit more as well. See if that reduces pain up here. Flip your legs around, whichever way you do it. Oh, sorry, sit up. I'm going to do the scratch test, so I'll turn your back here too. Bring your hand up as high as you can go. I'm going to mark the vertebral process. Good. How about the other hand? Good. And so if it's more than 3 segments, that's a positive after the scratch test. While she's in that position, I'll say keep your hand down by your waist. Push my hand away from you. That's the lift-off test. What muscle? The internal rotation movement. So what muscle? Subscapularis. Good. So then I usually come back and I will start finishing the range of motion and the strength testing. So I'll say bring your elbows to your side. Bring it back. There you go. Good. Wrist outward. Good. Come back in. That was external rotation. While I'm here, it makes the most sense for me just then to do the strength test on that. So I'll say, okay, elbows again right where they were. Now push out against me. So I'm going to resist her. Okay, now it's external rotation. What muscle? Do we go up or do we go out? We went out, so that was infraspinatus. So then we'll pull inward now. So pull against me, and I'm just going to resist her. Okay? That's subscapularis here. From there, I will. I forgot the impingement test, didn't I? From there, we can go empty can test. So hands out to the side, thumbs down, come forward a little bit. Good. Hold it right there. I'm going to push down, little empty push. Good. Empty can, supraspinatus muscle, right? Palms up, elbows straight, hold them there. I'm going to pull down. That was the speeds test for the biceps. Okay? Then we can do Jurgensen's test. So I'll hold her hand, bend the elbow, start in a pronated position, find that biceps tendon, go ahead and flip your palm up. Good, resist that, and see if that reduces pain. Okay? Impingement test then. Nice and relaxed here, loose, loose, loose. Grab it at the elbow, abducted, flexed, intro and rotate. So that's which test? Okay, so remember the flat weight. Nearest test, intro and rotated. What I didn't tell you on the slides, which I forgot to, is when you do the nearest test, you have to put your other hand on that scapula. So your fingers can be on the clavicle if you want, but most of the hand should be on the scapula because you don't want the scapula to come off with you. It normally will want to do that. So you hold it there, passively bring it up. So they should be relaxed. Okay? Should we do most of those? Go ahead and lay down. So again, I do apprehension and all the other instability tests laying down. So bring your arm out. So I get them as close to the side of the table as I can. I would get her closer, I just don't want the table to shift on us. But for the exam table, I usually would have her humerus right there. Abducted 90 degrees, bent at 90 degrees, and we'll just let her extend the elbow down a little bit more, and then externally rotate that humerus. So we want basically that forearm to be a little bit below the table. Not very far, but some. And I keep my other hand ready in case she feels pain or it shifts. If that causes pain before I can get to where I would expect to, then I dial it back, let her relax a little bit, put my hand here. Sorry, this one was apprehension. Once I dial it back, put my hand here, this is relocation. I'm going to go to that same spot that hurt her before. If it doesn't cause pain, that's a positive relocation. And then I let go, and if it reproduces the pain, that's a positive anterior release. While I have her in this position, I can do the crank test. So I'm going to say relax, nice and loose. I'm going to push inward, so I'm going to load that humeral head, and I'm going to rotate. Load, rotate, load, rotate. Okay? Other labrum tests, 90 degrees, 90 degrees. Bring your wrist to your ear. Good. That's biceps load 1. 120 would be biceps load 2. Bring your wrist to your ear. Good. Come back down to 90. Pronate the wrist. Bring your wrist to your elbow or to your ear. Good. That's memory stance. Okay? Alright. Go ahead and sit up. I'll have you stay with your feet that way, so you're facing that. Okay. For the other group, I forgot to show you load and shift and sulcus, so if any of you missed that, I'll show you again here at the break. So relax their arm here. The load and shift is going forward and back, the sulcus is down. So again, my fingers are right here. See where the acromion is? If they have a large deltoid, don't be out here. Make sure you're on the humeral head. So I'm going to push nice and hard right here, and I'm going to go forward and back, forward and back. It's not as gentle as what most people want to do. Most people want to do one of these. You really are going to push with some force. And again, you want to push with a little curve fashion. Sorry.
He said it is not gentle.
Yeah. What you mean to say is I'm a really strong guy.
No, it doesn't hurt, but you really are. He really is messing. I mean.
All right. So for sulcus sign, have them relax their arm again. Like I said, you could have them hang like this, but I really feel like I'm tearing on the skin and pulling it. So I don't like that. I like their hand on their lap. Then I can pull right here at the elbow and get a good leverage point, and then I pull down. Again, it's not just a simple tug. It's you're going to pull with some force to see if you can get it again. Okay? All right, O'Brien's test, pretty straightforward, straight in front and resistance. Okay? I did this for the other group. Do you guys want to time me and see how long it takes? You can see how this goes real time for me. You guys want to do this? Okay, so sit up here. Who's got a stopwatch? On their phone, tell me when you're ready. Go. Ready? Go. All right. Out to the side above your head. Good. Back down. Forward above your head. Good. Back down. Scratch your back as high as you can go. Good. How about the other hand? Good. Hand down here by your waist. Push out against me. Good. Other hand. Push out. Good. Relax for me. Nice and loose. Feel AC. Right there. Acromion. Bursa. Short head. Long head. Bring your arm across your body. Good. Stay there. Elbows to your side. Hold on before I forget. Let me do this picture. Nice and loose here. Relax. Good. Nice and relaxed. Good. Elbows to your side. Roll your wrists out. Come back in. Same thing against me. Good. Come in. Good. Out to the side. Thumbs down. Come forward. Hold it right there. Good. In the middle. Palms up. Hold it right there. I'm going to push. Good. Relax your arm. Bend your elbow. Bring your hand palm up. Good. Relax. Time.
59 seconds.
Sorry?
59 seconds.
59 seconds. Under a minute. Get the order. You guys can do this. Like I said, that's faster than